Good morning. So I want to encourage folks as they're coming in to try to move towards the middle of the seating, because we're going to have people coming in throughout. And we're going to get this thing going here. So while people are getting seated and getting settled, let me just do just a little bit of housekeeping. I'm LaMar Hasbrouck. I'm the Executive Director of NACCHO, and it's my honor and privilege to moderate what I am sure will be a very robust discussion and a learned session for everyone in attendance. In addition to the folks that are here in the room, we are webcasting live, so I'd like to say hello, good morning, and welcome to our audience that's joining us through virtual means, and they're going to be here with us. Immediately following this session, the panelists and I are going to walk over to another room where we're actually going to be able to have a large an exchange through Twitter. So another live exchange that will follow this. So this is your session here. So we're going to be entertaining questions and interaction and dialogue from you all here in the room. But after, we'll be able to entertain those who may be interested through Twitter after we wrap here. So I've been asked to just give a couple of announcements here in terms of our feedback. Or the feedback we want to solicit from you. So there are cards in your chair. So we want you to use those cards immediately after this session. Give us your feedback so that we can learn from this session and learn how to do things better going forward. And then after the conference ends, after it wraps today, probably in another couple of days or so, you all will receive a link from us, an email from us, asking you to give us an evaluation of the entire conference. And during that time, you'll have an opportunity, you'll be in a drawing for a complimentary registration to come back next year. We hope to see you all back anyway, but we're going to complimentary comp your registration for at least, I think, 3 folks as you complete your evaluations. So with that, I'm going to tell you how we're going to run this session. I'm going to give just a few remarks to set the context from my personal perspective, and then I'm going to introduce each of our panelists in turn. After I introduce them, then they will then in turn come up and give some remarks, and then after that we'll open it up for a lively exchange. So, a little bit about me. My name is LaMar Hasbrouck. I am the Executive Director of NACCHO. I am also a physician by training. And if it's been lost on you, I am also an African-American man. I have 3 daughters. And it is as an African-American man that I have experienced life. So I have life experience and lived experience as an African-American man. And in that experience, I have had interactions, and let's call them encounters, over my lifetime with law enforcement, with police, other law enforcement, other safety agents, and many of those interactions or encounters have been positive. Some have been very positive, and some along the way have been not so positive, and some have been downright negative. But it has been my experience as a second-year medical student in Los Angeles at a place called Charles Drew University of Medicine and Science, a joint program at UCLA School of Medicine, that has probably formed my biggest interest in this topic area for today. Because when I was there in 1992, something occurred. And something lit a fire across America when a gentleman named Rodney King had an encounter with law enforcement, with the LAPD, which was very documented. And for those of you that remember, and many of us that were alive very much remember this, it sparked a national debate. And it sparked a debate around the interactions between civilians and citizens in law enforcement. And it in fact was a powder keg of sorts in terms of igniting a reaction to that interaction between Rodney King and law enforcement that erupted across a community, that erupted across Los Angeles City. And again, I was a medical student at the time, so I was right in the middle of this swirl of activity. And I can tell you that as a medical student and as an African-American man, in that context at that time, it was very alarming for me. It felt very unsafe and uncomfortable for me as I drove home from medical school under martial law and under a curfew, and with fires and eruption and lootings happening all around me. And as this black cloud kind of made its way over the city of Los Angeles, and there was something infectious about it in a negative way. And at one point in time, I found myself at an intersection of a very strange, odd, and uncomfortable dilemma. There was me, there was a Korean-American gentleman, and there was a white gentleman at an intersection. And just to fast forward that interaction, I was trying to get to where I was trying to get to. There was a Korean gentleman in front of me who was not moving. And again, this cloud of negativity was over the city. And I began to sit on my horn and start riding my horn to see why this guy wouldn't move. Eventually, I jumped out of my car, slammed the door, went over to confront the gentleman, the Korean gentleman, to find out, what's taking you so long? Get moving, let's go. I got somewhere to go. As I caught myself in that interaction, I said, well, why am I out of my car? Why am I confronting this gentleman? It's unsafe for me, it's unsafe for him. What's going on? As I was collecting myself and turning back to my car, the white gentleman behind me was doing the same thing. He got out of his car to confront me with a tire iron. And so as I turned, he had a tire iron and he was approaching me, and I was like, whoa, 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 and he snapped to his senses. So you had a Korean gentleman, a black gentleman, and a white gentleman at an intersection of misunderstanding, of tension, of confusion. We all de-escalated and went back to our cars, but if not for that brief awakening, I could have been in a very bad situation. And in fact, we saw folks being pulled out of their cars and being beaten half to death during this sway of this interaction. So we have seen in recent years, in recent months, other situations that have erupted across our nation. Ferguson, Missouri, Baltimore, Maryland, Cleveland, Ohio, just to name a few. So this is back in the media, this is back on the topics of Americans, and this is something that we need to engage in. So let me say at the beginning of this session is not about demonizing or villainizing law enforcement. We understand how important they are. We understand that health and safety go hand in hand, but we also understand that we need to broker a better positive relationship. There have been historical tensions and historical challenges around the way certain populations interact with law enforcement. This is an opportunity to move our understanding forward. This is an opportunity for us to better understand this interaction and how we as local health practitioners can partner with our public safety and law enforcement partners to do what we all want. We all want healthy, productive citizens with cohesive communities so we can go forward in a positive way. So with that sets the context for what we're doing. And if you don't get anything else out of today's panel discussion, I hope that we can move your understanding, your openness just one step forward in thinking through ways and opportunities where we can build bridges to make sure our communities are safe, secure, healthy, and well. So with that, let me introduce our esteemed panel who is going to help kind of give some of their experiences and help set the tone for a very, very active discussion. Our first panelist, I'm going to go from left to right, is Dr. Leana Nguyen. She is Baltimore City Health Commissioner. She is an emergency physician. She is a public health leader and a patient and community advocate. She serves in Mayor Stephanie Rawling Blake's administration to lead the oldest health department in the United States, with over 1,000 employees working to reduce disparities and improve health for those who live in Baltimore. Next to her is Ms. Jasmine Graves. Through her research and her work, Ms. Graves seeks to incite critical thought about social injustice, including understanding and social determinants of poor health outcomes experienced by communities afflicted by mass incarceration. Ms. Graves currently serves as Special Assistant to the New York City Department of Health and Mental Hygiene Commissioner, Dr. Mary Travis Bassett, where she supports the commissioner in developing policies and initiatives to advance the health equity of New York City, serving as content expert in areas related to correctional health. She also serves on the advisory committee of the Human Impact Partners Health Impact Assessment on tuition assistance policy for people in prison. And prior to this role, Ms. Graves was a part of the Bureau of Correctional Health Services, again at the Department of Health and Mental Hygiene, where for 3 years she worked on several projects on Rikers Island. That included, but were not limited to, injury surveillance, program development for incarcerated youth, and qualitative data analysis. She continues to engage in this work by providing support to young adults currently incarcerated on Rikers Island. Ms. Graves received her BA in World Arts and Culture from the University of California, Los Angeles, and her MPH from the Mailman School of Public Health at Columbia University. Next to Ms. Graves is Chief Jeffrey Blackwell. He is the 14th Police Chief of Cincinnati. He's focused on forging new relationships with federal, state, and local organizations and implementing new initiatives to fight crime and improve the quality of life for all Cincinnatians. He has worked to maximize collaborations throughout the entire city, with particular emphasis on marginalized areas of the city. In his first year, Chief Blackwell was instrumental in holding an inaugural series of town hall meetings in each of the 5 police districts to hear from the citizens and to provide district-wide policing updates. He's had nearly 1,000 citizens attend those meetings. Additionally, Chief Blackwell has participated in over 150 speaking engagements in 2014. He has stressed the importance of building authentic relationships with community members through collaboration and through engagement. Through his leadership in the Cincinnati Police Department, he's implemented a robust youth engagement platform with a host of character-building activities. Chief Blackwell has also placed a great amount of focus on the youth overall in Cincinnati, building relationships and trust, as well as improving human connectivity for further reduction in crime. He has worked to meet people, both young and old alike, where they are, and to be authentic, transparent, and accessible. While at the Columbus Police Department, which was a job he had before this one, he became only the 3rd African American to rise to the rank of deputy chief in the agency's 200-year history. He's worked in patrol, traffic, street crime enforcement, internal affairs, cold case homicide, and many other assignments during his 28-year career. Chief Blackwell is a member of the Major Cities Chief Associations, the International Association of Chief of Police, the National Association of Black Law Enforcement Executives, the National Association of Blacks in Criminal Justice, Police Executive Research Forum, Fight Crime, Invest in Kids, and he also co-chairs the Cincinnati Immigration Task Force for Safety. He's an active board member of the Boys Hope, Girls Hope, the YPE in Cincinnati. He graduated from the Certified Law Enforcement Executive Program in 2011, Police Executive Leadership College as well, Southern Police Institute Internal Affairs School, and he graduated from Columbus Police Academy. He holds a BA in Business Administration from Mount Vernon Nazarene University. Please join me in welcoming all of our esteemed guests. So with that, I'm going to invite our first speaker up, Dr. Nguyen.
Good morning, everyone. So I first want to thank Dr. Hasbrouck for not only inviting us here and putting together this fantastic panel. I'm really delighted to join Ms. Graves and Chief Blackwell on this important day. But I also want to thank Dr. Hasbrouck for putting such a terrific frame for our conversation today. I thought that was speaking from your personal experience and also your extensive leadership and public health and government service experience. I'm very happy to be here to take part in this conversation with all of our panelists and with all of you. I'd like to take us back to one day that I will always remember, and that day is Monday, April 27th. 2 weeks before that, a 25-year-old named Freddie Gray was taken into police custody. He died a week later, and the morning of April 27th, with his funeral. And we could not have predicted what unfolded that afternoon and evening. What we saw, what the world saw, was Baltimore burning, literally. There were dozens of pharmacies and stores that were looted and destroyed. There were hundreds of cars that burned, and dozens of people were injured, dozens more were arrested. Now, I remember that day well because our health department was a lead agency along with fire and police and emergency management in the response to the unrest. We were initially concerned about figuring out the safety of our employees. One of our health clinics is right across the street from the CVS that was in the news all the time, the CVS that was looted and burned at Penn and North. And we had hundreds of other employees who were in the field. They were doing home visits for pregnant moms, doing lead abatement work, working in senior centers, doing field health transports. And that afternoon, as we got more threats, as we had more uncertainty about the violence that may be occurring, I remember sending out emails, sending out alerts, sending out text messages, imploring our employees to go home because this wasn't safe for them. I mean, these were people who were going into areas that were literally burning and rioting. But you know what my employees said? They said no. They said that they needed to keep working because it wasn't just random people out there that they were serving. They said the people that they're serving, they're our friends and our neighbors and our family members. And they themselves lived in areas too that were burning and rioting. And it struck me at that moment that this is what it means to be working in a local health department because we really serve the needs of our community. We're really deeply embedded in the city. And I continue to be inspired every day, just as I was that particular day, by the dedication and just the heart that all of our employees show. Now, a lot has happened, even though it's only been 2 months or 2.5 months since that day in April. A lot has happened, and I'd like to share with you today 4 lessons that I learned, both in the immediate aftermath and also in the recovery. And I want to tie into these broader issues, these broader lessons that we're learning on violence and disparities and race. The first lesson is that we have the ability and the obligation to be nimble and flexible so that we can meet the needs of our community members. You know, there's a lot that we did in the wake of the unrest that I'm not sure I would have ever imagined us doing. For example, we found out that over a dozen pharmacies were burned, looted, and otherwise destroyed. And that people were calling us saying that they were going without their medications. There was a woman who called me. She was speaking like this, and she couldn't barely talk. And she said she was out of the medication. And I thought maybe it's her inhaler, maybe she has asthma, COPD. The medication she was out of was Coumadin and Lovenox. She was being treated for pulmonary embolism. We had to figure out not only how to get her the medication, but how to transport her to the ER at that point. Another woman called us and said that she had a strategy for dealing with this, for dealing with lack of medications, and that was that she had diabetes and was out of her insulin. But she stopped taking her insulin because she didn't have any, and so she also stopped eating. By the time that we found her, she was in diabetic ketoacidosis, barely awake. And so for us, a lot of our work initially in the first 24 hours, we had to figure out how to get medications to people, which sounds simple, right? I mean, you can say, well, Baltimore, there are dozens of other pharmacies that are functional. But imagine you're somebody without a phone. How are you even going to call the pharmacy to get your medication transferred? Or let's say that you normally get your medications at CVS, but now you have to get it transferred to Rite Aid. It's not that simple to do. Or walking a few extra blocks may be okay for people who are able-bodied. But if you're someone in a wheelchair with a walker, maybe you're oxygen dependent, that extra 3 blocks could literally mean the difference between life and death. So within the first 24 hours, we figured out a way for people to get access to medications through a 24/7 access line that people would call. And we would literally deliver medications to people. And there were also all these seniors who could not get to their grocery stores. I mean, if you were watching TV, then you don't know whether everything is burning down outside your door. They had no idea how safe it was, or whether they could get there. And so we set up shuttles outside 10 senior centers to get people to get medications, to get food, and to get other supplies like diapers and Ensure. Now, those are not things that I ever thought that we would do with the health department. I mean, we were ready, just like I think all of you and local health departments are ready in preparedness. But it's also important to be nimble and to be flexible and deliver the care that our residents really need. My second lesson that I learned is that the care that we deliver goes far beyond physical health. And we have to talk about mental health, and we have to talk about trauma. You know, a few months ago, before the unrest, I was speaking to a group of 8 to 15-year-olds. And I was asking them, as part of my listening tour, similar to Chief Blackwell, it's just, you know, what was the biggest health issue that they wanted the health department to be working on? And I thought they would say things like STDs or smoking or whatever else that they heard in school. But you know what they said? They said the number one issue, even though they didn't articulate it, but this is what they said. They talked about being terrified to walk to school. They were having flashbacks of watching their uncle, their brother, their father being shot. Or many of our kids talked about being in school and acting up. And instead of being talked at or talked to, instead they were handcuffed and thrown in the back of police cars to be brought to the ER to be assessed. Other people, other kids, these are 8 to 15-year-olds, talked about the trauma of growing up poor, of not knowing whether they'll have a roof over their heads, of not knowing why they should even go to school every day because everybody else in their family is addicted to drugs and they don't get up in the morning. So why should this 12-year-old get up in the morning? You know, we were thinking then that this is almost the perfect setup for PTSD and huge mental health needs. Right? If you had to come up with what it's like to, what are all these things that you can imagine that would be set up for people with huge mental health needs. It's what our community goes through. So is it any wonder that we see the consequence of trauma in breeding even more violence in our city? And so what we did in the wake of the recovery was to set up a citywide mental health and trauma recovery plan, because we know that there's already so much trauma and how much more trauma would have been caused by everything that occurred. So we set up, and we have now, a 24/7 emergency crisis response line, an urgent care line to help people make appointments where people can immediately access a social worker or counselor. And because there's so much stigma that's associated also with trauma, that we have healing circles that are going out to local schools and church groups and community groups that people can access by calling our 311 line. Now, I know that this doesn't even come close to addressing the pervasive trauma that there is, but it's one step that we're taking, one thing that we're trying to do as we address the underlying problems that so many of us are facing in our city. Speaking of which, my third lesson is that this is the opportunity to tackle the root causes of problems. You know, we see violence, and I think the temptation is always to attribute that violence to what you see immediately. You see youth throwing rocks, and so you say, okay, the problem is the youth, it's the disaffected youth. But is that really the problem? Is that really where violence is starting? Maybe we should also be talking about the legacy of discrimination that causes disparities that run so deep that it almost becomes blasé. You know, I hear talks in public health circles as well as in general. We talk about, for example, in Baltimore, the 20-year difference in life expectancy based on zip code, based on the block in which people live. And we talk about that, and we can name every racial disparity under the sun, and it almost becomes like, well, that's just something that happens. I mean, we have food deserts, for example, in Baltimore, where 1 in 3 African Americans in Baltimore lives in a food desert. 1 in 12 whites do. I mean, I can name these statistics just like I'm sure you can for your cities all day long. But I think we have to talk about other drivers. How about the problem that exists across the US that you heard Ms. Graves, I believe, is a specialist in, mass incarceration? Let me give you some statistics from Baltimore. We have a population of 620,000 people. Every year, there are 73,000 arrests that are made. Okay, 73,000 out of a population of 620,000. For individuals who are in jail, 8 out of 10 use illegal substances. 4 out of 10 have diagnosed mental illness. So how about let's take this opportunity not only to point fingers, but actually to figure out how can we get quality behavioral health treatment to everyone who are the most vulnerable, instead of criminalizing addiction and throwing people in jail who actually have mental illness. You know, nationwide, I know that we heard an excellent panel yesterday about opioid addiction. Nationwide, just over 10% of people who have substance addiction are getting the help that they need. I find that statistic to be completely shocking and completely unacceptable. For what other disease would we find that acceptable? That 1 in 10 people who have cancer get chemotherapy? 1 in 10 people who need dialysis get it? I mean, we would never find that to be acceptable, and so why do we find it acceptable for behavioral health? Now, we know that in Baltimore, just like everywhere else, these are not new problems that have surfaced in the wake of Freddie Gray. And in fact, in the words of Dr. Paul Farmer, these are acute and chronic issues, and we have an opportunity to address it. And so for us in Baltimore, on Monday, we're going to be announcing our new, the reports of the Mayor's Task Force on Heroin Prevention and Treatment. And part of our efforts are also going to be working on real treatment on demand, 24/7 treatment on demand, and universal case management for every individual leaving our jails. That is how we can get to at least some of the real underlying problems of disparities and unrest. My fourth is that we can't do it all, but we have to start somewhere. You know, we look at issues like violence and drug use, and of course, it's all very complicated. It would be folly for any of us in public health to say that we're the ones who have to solve it all, right? That's not possible, and this is why we depend on so many great other partners in the city. But you know, I'm a clinician, I'm an ER doctor, and when we see a patient who's very complicated, let's say a patient on chemotherapy with chest pain, on dialysis, who's obtended, who may have been in a traumatic accident, we don't just say, it's too complicated, let's let this patient die. Right? We would never say that. We know that we have to start somewhere. And maybe that somewhere isn't the right approach, but we have to start somewhere. And that's why everything that we're hearing at NACCHO about violence being a public health issue, let's start with a public health approach, I think these are absolutely important. And all of us, as leaders in local health departments, we also play a critical role because we do have the trust of our communities. We are seen as neutral conveners, and there's a lot that we can do in order to be that convener and to start somewhere. So I want to just start and end today with that day on April 27th. Now, one of my heroes is Congressman Elijah Cummings, who said at the funeral of Freddie Gray, before all of this happened, he said, "Did anyone recognize Freddie Gray when he was alive? Did anyone see him? Did anyone hear him?" It's our job in public health to see the people that society otherwise prefer not to see, to hear the individuals who are cast aside and who are given many times no voice, and to recognize that the underlying problems like structural racism, discriminatory practices, and ever-present trauma, they are what got to us to where we are, with deep disparities that then breed violence and unrest. Well, for us in Baltimore, our city may have burned, but our problems may have been on full display to the world. But we all know that these problems are not unique to Baltimore. And in fact, I know that all of us in this room, we can agree that these are not African American problems. These are not minority problems. These are not inner city problems. These are not poor problems. Because when they erupt, we see that they're actually America's problems. And when they erupt, they're just the same. They're causing the same havoc, and they're bending the arc of our universe away from justice. All of these are our problems, and April 27th and so many other events in recent history are a clarion call for all of us in public health to address them, to fight disparities, and to aim towards equity and justice. Thank you.
Good morning. Can you all see the slides? No? They're okay. So thank you, Dr. Hasbrouck, for that wonderful introduction. It is truly an honor and a privilege to be able to stand before you all today and to be able to participate on such a distinguished panel to share some of my thinking on this issue of police violence, but then also the thinking of some of the leadership at our agency. I'd like to begin this morning by sharing 3 findings taken from a report written by one of this nation's leading sociologists on police brutality. The findings are as follows. Number 1, the police show little regard for human rights and constantly violate Blacks' fundamental rights as citizens. Number 2, police aggressions and brutalities, more than any other factor, weld the people together for mass action against those responsible for their ills. Number 3, it is clearly the responsibility of the police to act in such a way as to win the confidence of citizens and to prove themselves the guardians of the rights and safety of the community rather than its enemies and oppressors. These findings were taken from a report written by E. Franklin Frazier 80 years ago. And sadly, the reality and the truth of his findings still ring true today, which begs the question as to whether we have been asking the right questions and using the correct context to understand the issue of police violence in the United States. So I'd like to take a few moments this morning to briefly situate us in the context of history. This timeline maps 5 of the most popular civil uprisings spurred by police violence in U.S. history. The point of this slide is to highlight that the same uprisings that occurred this year in Baltimore and last year in Ferguson also occurred, as Dr. Hasbrouck mentioned, in Los Angeles in 1992, Watts, California in 1965, and Harlem, New York in 1935. However, to truly understand the underlying cause of the tension that exists between the police force and Black communities more specifically across the United States, we must understand the ways in which Blackness and Black bodies have been both criminalized and dehumanized in our history. So I invite you to follow me on a very, very brief journey through our history that has created this tragic phenomenon. Are you all ready? Yes. Awesome. So as many of you may have guessed, this journey begins with slavery, where for 256 years, people of African descent were considered chattel property and identified as 3/5 of a human in our nation's constitution. This period also marks the development of slave codes, which were later redefined as Black codes during the period of Reconstruction. These Black codes, best known for their adoption of vagrancy laws, made issues such as unemployment a crime punishable by incarceration and forced labor for formerly enslaved people. The period of Reconstruction is followed by the Jim Crow era, where for 75 years, our nation implemented legislation that cemented segregation. This is the period best known for its practices of separate but not so equal. I'd like to note that the Jim Crow era is also known for the mass lynchings of Black people that often occurred without justice. And finally, we get to the Civil Rights era, where many people successfully fought collectively across racial lines to repeal the separate but equal laws from the Jim Crow era. This is the era that passed the Civil Rights Act of 1964, the Voting Rights Act of 1965, and birthed the prominence of Black leaders like Malcolm X and Dr. King. However, this era also marks the period with the highest rates of police killings of Black people. This trend graph created by Dr. Nancy Krieger and her colleagues at the Harvard School of Public Health depicts the rate of Black versus white death due to legal intervention from 1960 to 2010. As you can see here, there's a spike in the mid-1960s and early 70s, followed by a downward trend in the 1980s for what I suspect is the advent of mass incarceration. Which brings us into the present day, where approximately 1.5 million Black men are missing because of incarceration and early death across the nation. One last historical point I'd like to draw on to bring us from history to the present day is the practice of leaving dead Black bodies in public spaces. Last year, I attended a panel convened at the Schomburg Research Center in Harlem, Or Darnell Moore, one of the organizers of the Black Lives Matter ride to Ferguson, described the experience of seeing Mike Brown's body lay in the street for 4 hours as neo-lynching. I'm going to let the juxtaposition of these images sink in for a moment. The practice of leaving dead Black bodies in public view conveys a number of messages that carry dire consequences for people of African descent. The main message being that Black life is of less value, and that at any time, any person, man, woman, or child can be killed, often without justice. I'm going to switch gears now for a moment and briefly share some examples of the public health implications of police violence. Borrowing from the socio-ecologic model, I offer up some examples of direct health impacts of police violence on the individual, family, neighborhood, and national community. However, in the interest of time, I'm going to share just 2 examples. In exploring the impact to the individual, I'd like for us to consider the case of Tamir Rice, who at 12 years old was shot and killed by police officers in Cleveland, Ohio, as an example of premature mortality and years of life lost. If we use the national estimate of life expectancy for Black men as a marker of full life, that being 71 years of age, then Tamir lost 59 years of potential life. 59 years to be a contributing member to his community and the larger society, 59 years to become a father or perhaps even a grandfather. When exploring the direct health effects to the family members impacted by police violence, I would like for us to put ourselves in the shoes of Ramarley Graham's grandmother and 6-year-old brother, who had to witness the police murder Ramarley in their home. Can you imagine the emotional and psychological trauma they now live with day in and day out? The implications of police violence also carry a few indirect health effects. For this, I'd like for us to consider the impact of police killings and surveillance on the social determinants of health. In public health, we often discuss people's reluctance to engage in physical activity, for example, because of concerns about safety. However, we need to begin asking ourselves how much of these concerns as fears stem from the tensions that they carry with the police and heavy police surveillance. What does it mean to live in a neighborhood where on every corner there are police cameras, and in the hallways of your building there are police officers? What impact does having metal detectors, search dogs, and police precincts in schools have on the quality of our children's education? These are all questions I hope we can discuss today and consider in our day-to-day practice as public health professionals. Ladies and gentlemen, I stand before you today as a colleague in public health, but also as a Black woman whose heart is heavy with the pain I continue to witness my community experience. And that's really hard to say. So I ask you to join me in collectively envisioning a path forward to address this issue. In closing, I'd like for us to consider the following recommendations put forth by our field's leaders and governing bodies. 17 years ago, the APHA published the recommendations you see here on the screen, among many others, to address this issue of police violence. My boss, Commissioner Mary T. Bassett, recently published a piece in the New England Journal of Medicine urging us to consider racism, or more specifically structural racism, as a fundamental cause of health inequity. And lastly, Dr. Krieger urges that we do all of the above and draw on the expertise of colleagues in allied fields to better understand the breadth and depth of this issue. My hope again today is that we consider each of these recommendations and the context that all of us are living within and the historical frameworks that often get lost in our field to find some lasting solutions so in the coming years we don't have to meet here to discuss this issue again. I thank you for your time, and I look forward to learning from my fellow panelists and all of you during the discussion. Thank you.
You just knew they were going to make the police chief talk last, right? Put me on the end, made me talk last. I'll say to all the doctors in the room that I, too, wanted to be a doctor when I was a young freshman at Case Western Reserve in Cleveland, but organic chemistry told me to join the police department. Ready? But I will say that most of the doctors in the room really wish they could drive a Hemi Dodge 120 down the freeway and put the lights on. So we want to be each other. I'm going to skip a couple of the slides that don't pertain because first I'd like to say that, I'm a little bit of an outside-the-box thinker. I've been a police officer for nearly 30 years, having grown up in the projects of Columbus, Ohio, to a single-parent home on welfare. Both me and my brother went to very good colleges based on the strength and determination of my father. And I, too, share some of the sentiments that were displayed by the three previous speakers about some of the issues surrounding policing in America. Make no mistake about it, every one of our major civil unrest scenarios in this country have been tied directly to police misconduct, or at minimum, perceived police misconduct. And we have to own that as police officers. We have to own our place in history of being the ones on the Edmund Pettus Bridge 50 years ago fighting with people, and being the ones who were sicking German shepherds on people, and being the ones in the furtherance of Jim Crow and other nefarious practices. And until we own that, policing will be a little bit mired in the mud. We're stuck, but we're moving forward. So in Cincinnati, we do a lot of things a little bit differently, okay? I believe that there are no individuals in society more uniquely positioned or created to impact young people and impact some of the social problems that we have in this nation better than police officers. Because we're there in the cracks and crevices every day, every single day, in the good neighborhoods and in the bad neighborhoods. We're there, the men and women that wear the badge in all of your communities. The problem in many communities is that policing is misguided. Police officers are taught to be warriors and not guardians. We're taught to fight crime, and we deal with crime and criminality and not life and livability. I believe we should do the latter. I believe that we deal with community engagement first, and then law enforcement second, and law enforcement becomes easier to do. So if you look at the slide here, these are just some of the things that we've done in Cincinnati. These are programs, and we got a little bit of a problem there with the slide, but H3 Cincy is a program I started last year. The 3 H's, I'm big on acronyms. I'm going to tell you all about my acronyms. This one is Hoops, Heart, Hope. It is a basketball program as described by the citizens of my great city of Cincinnati, but it's not really about basketball. You see, if I was going to tell young kids in Cincinnati, age 10 to 19, that they got to come and listen to me speak every Friday night from 6 to midnight, the only child there would be my son, and he would be handcuffed to me. And I didn't want that. So we put basketball in as the hook to get young people excited about it. We went to 5 rec centers geographically in each of our 5 districts in Cincinnati. It started at 6 p.m., and at 6 p.m. we fed all of the children a hot, nutritious meal. We fed them a nice hot meal, and the kids were hungry. The kids were very hungry. After the meal, they had to participate in an hour-long character, integrity, and leadership workshop to earn the right to be able to play basketball. But they didn't just get to play basketball in the gym. I started midnight basketball in Columbus in 1992, where I just went in the gym with some of the gang boys to try to keep them from shooting one another. This was much different. We bought the kids brand new uniforms and brand new shoes. They played in gyms with referees and scoreboards and cheerleaders and fans and media. we glorified our young people after we fed them and we taught them. The lessons they range from financial literacy to conflict resolution, to manners, to drug resistance and education. Each of the 10 weeks of the program was a different topic for the young people. Now, let me just say this. Most of you know that a lot of people think that violence is about gang-related activity and drugs, and it is to some degree. But in most big cities in this nation, from Baltimore to Cincinnati to Los Angeles, it's more about beef. It's more about two groups of people or two individuals having some type of conflict with one another, and they feel emasculated enough to use a firearm to handle it. And so in Cincinnati, we have 52 named neighborhoods, and we have the same dilemma. We have kids that live in Walnut Hills that won't speak to kids that live a block away in Avondale. So what we did with our 300 kids in the program, we tried to get them to take a picture, to start off everything, and the photographer kept telling the young people to move in, and they wouldn't stand close to one another. How dare them be caught next to a kid from Price Hill and they live in Bond Hill? At the end of the 10th week, when we had our championship, when we had our banquet, when we gave each of the kids trophies and plaques, we literally had to put Johnny Cash on the loudspeaker to get him to go home. They would not leave. They had fallen in love with one another, and they had erased the geographic boundary as an underlying determinant of future violence. And what I mean by that is this summer, when a kid from Price Hill runs into a kid from Avondale that he played ball with in the H3 Cincy program, there's not going to be conflict. Conflict that in some cities is automatic. Just when two groups of kids see each other and they're from opposite sides of the city, there's instant conflict. We've tried to eradicate that. And another thing we did with our 200 boys and girls aged 10 to 19 is we tracked their success. As a police officer in an evidence-based agency, everything has to be dealt with empirically, right? And we can't measure love. You just can't measure it. So because we can't measure love, I had to put some numbers there to appease some of my bosses. And so we tracked every one of our young people. We still track them. We keep track of them in school, and the ones that are out of school, we keep tabs on them as well. And we track crime around those 5 rec centers in pretty rough neighborhoods in Cincinnati. And for the 10 weeks of the program, between the hours of 6 p.m. and 12 midnight, there was not one crime committed within a 500-foot radius of those rec centers involving a young person. Not one. So not only anecdotally, but empirically, we know the H3 Cincy program is working. So as I talk to other chiefs, and believe me, we get together a lot. The major city chiefs, Bill Bratton from New York and formerly Anthony Batts. Unfortunately, he's no longer with Baltimore. He's a good friend. We get together 4 times a year and we talk. And I can assure you all, if you're from a major city in the United States, your chief is probably thinking along the same lines as me. How do we change the complexion of policing? How do we make our services better? How do we change? I think, and I've shared this with people, you cannot wait until Freddie Gray incident happens, or Tamir Rice in Cleveland, or Eric Garner in Staten Island, or Rodney King in '92, which most young police officers don't even know who Rodney King is. You can't wait till something like that happens to try to sit down and build relationship. You have got to build a relationship with your community long before there's turmoil, so that the relationship is viewed as being authentic and transparent. And when you have an authentic, transparent relationship, people in your community will allow you to make a mistake. They know cops aren't perfect. We're human. Al Sharpton told me once when I was in New York City at a conference on race and policing, and he said, "Chief, let me just tell you one thing. If something happens in your city and the folks there feel the need to call me, that means they don't know you." Well, they know me in Cincinnati because they see me every day, and they know what my walk is about. And my walk is about giving back to the young people and building them up. I started another program to help impact 2 things. First, the heroin epidemic in Cincinnati is as bad as it is anywhere in this nation, and we're trying to help impact the heroin epidemic. So I started a program called CHILL, Character, Humility, Integrity, Leadership, and Love. And I spread it out to the suburban high schools around Cincinnati that don't even fall under my jurisdiction. Why did I do that? I did that because we know that we need to impact and help eradicate the no snitch mentality that's prevalent among our youth, not just Black and Hispanic youth in inner cities, but all of your youth, your kids as well in this room. The no snitch mentality is allowing children in the suburb schools of Cincinnati to die of heroin overdoses when their classmates know that they're using heroin. We're trying to create leaders today in our young people in our high schools so that they have the courage to stand up and do the right thing so that one of you or me doesn't get the call that our child has overdosed on heroin and the entire class knew, but no one had the courage or the leadership within them to let you know. So we're trying to impact it there. And we utilized a lot of our University of Cincinnati interns. And I can tell you that when we first asked our University of Cincinnati interns, excuse me, to get involved, they were like the doctors in the room. They wanted to jump in the cruiser and go to crime scenes and see the carnage that police officers unfortunately have to see every day. And they were a little disappointed that they were asked to do something different. But after the first couple of weeks of this program and the next one I'm going to talk about, they fell in love with it and they don't want to do anything else. Most of you know that U.S. Attorney General Loretta Lynch visited my city last month, and she visited my city to look at a program that I created called the Right to Read program. I have a program called the Right to Read program to help our third graders in Cincinnati pass the third grade reading guarantee. Now, this is risky, so if things don't work out for me, hopefully one of you will give me a recommendation in your city for a chief's job. Because as crime stays steady, I'm being pushed in multiple directions to abandon all of the things that build up our young people and simply fight crime. We all know that in Ohio, they have a third grade reading guarantee. Kids have to take a test. If they don't pass it, they don't matriculate to the fourth grade. The problem is that most of those kids, if you track them, when they have problems going to the fourth grade, they also have problems graduating from high school. Everyone in this room knows when a kid doesn't graduate from high school, they're doomed to a life of poverty and/or criminality. Why do I want to build future customers? In fact, I want to interrupt the cradle to prison pipeline, not contribute to it. And so we have officers and UC interns in the schools tutoring and mentoring third graders every day. In fact, our officers' title are educational liaison police officers. They're building up these young people. Now let me show you what they did. It's a little typo over on the top, but at the first school we went to in Avondale, they raised the third grade reading score from 52% to 77.5. 77.5. Fifth grade science score went from 4.3 to 25.9. Still not good, but better. Fifth grade math increased. Sixth grade scores increased. We were making a difference. We moved on to Chase Elementary, another elementary school. We raised their scores up by 60%, and every one of the third graders passed this year, and last year the principal says that 40 children didn't pass. I also developed a partnership with our Boys and Girls Clubs in Cincinnati. We have 5 clubs. I'm a Boys and Girls Club kid myself. I'm going to ask you to look at the screen and tell me who's happier, my officer or the little girl. This little girl, McKenna, was failing school. And she wasn't failing school because she wasn't smart. She was failing school because of self-esteem issues. Officer Jordan started to work with her, gave her a cell number. They talk every day, still in the summer. She calls my officer every day. We're in the Boys and Girls Club in the Book Buddies program, helping young kids learn how to read and stay focused academically. This takes officers off the street. No mistake about it. It takes officers out of squad cars. It takes officers away from fighting crime. But we're building up our young people. And for those municipalities in the room that have agencies where you don't have the diversity you need, and you have people saying, maybe your chief, maybe your mayor is saying, we can't find enough minority kids to be police officers. Not true. Simply not true. The bottom line with that is our kids will only join an organization that has the values that they have within their heart as well. And so for now, Baltimore's going to have a problem. Cleveland's going to have a problem. Other cities are going to have a problem until they change the way they police. But another thing comes to play. When you're building up young people and developing relationships with them now, you've got a whole bunch of kids that might want to be police officers instead of doctors in the future. You got a whole bunch of kids that want to join a profession that allows them to impact people's lives every day and truly be a difference maker. Our superintendent of schools, Mary Ronan, has embraced all of my programs. New York City came to Cincinnati a couple of months ago to ask about how we are involved in our schools in the city of Cincinnati. We have a very robust SRO program, right? School Resource Officer program. One of the first things I did in Cincinnati, and I did it in Columbus, was talk to my SROs to remind them that they are not there to criminalize adolescent behavior. They are not there to take kids to jail. They are there to develop relationships with young people and build and lift them up. Because we can't contribute, as Michelle Alexander says in the New Jim Crow, we can't continue to contribute to the cradle to prison pipeline. One of the ways that is further is in schools with SROs, school resource officers, who take kids to jail for doing things that all of us in this room may have done when we were young, and at best, we got a suspension. Or maybe, at worst, they called your parents. And we didn't want that. And so I'll close by talking about the PTSD that we know exists in our young people. We have kids in our city that are afraid to walk through their neighborhoods. They're afraid of other young people. They're afraid of the violence that impacts their lives every day. We have to recognize that PTSD. See, the kids that are in the life, the kids that are in the game, they think they're going to die every day. And when you talk to young people like you'd have in your research, they will tell you that. They don't expect to live past 18 or 21 for sure. But what you probably don't realize is that the other kids who aren't involved in the life, they are equally afraid of those kids. As they try to navigate around the nonsense in your cities and in your communities, they have a healthy level of stress. So we put up a series of billboards in Cincinnati with the title, "You Matter to Us." And the first billboard you see on the left, with my officer, those 3 kids are all homeless and gay. And they're all homeless now because when they came out to their parents, they were kicked out of their homes. I didn't realize how prevalent that was. But we all realize what these young people, that little boy and those 2 girls, will have to do in Cincinnati to survive. They'll become victimized on the streets of Cincinnati. I'm big on fatherhood. I believe that's the single most determinant factor in our cities and our neighborhoods that keep us in a cycle of poverty and a cycle of lack. We don't have as many fathers as there should be. And then we're just focused on youth. We're really focused on youth. We have a cadet program with over 75 explorers, and then we have 40 cadets that we pay every summer to learn law enforcement and to be with us when we do our jobs. One of the things I'm trying to do is build our way out of crime, not arrest our way out of crime. We have to build our way out. I'll close with a program that I started. Everyone probably has a shop with a cop in your neighborhood, right? We do too. But we also do one other thing. We have a program called Get the Groceries. And we took 200 kids shopping this Christmas. 1 week before Christmas, we infiltrated the largest Kroger's in Cincinnati with 200 kids and 200 cops and 100 volunteers. And the manager, who you see in the top right slide with the white shirt on, I was so afraid that he was going to be angry with me. I was in the Hyde Park Kroger's of Cincinnati, and it was already crowded, right? A week before Christmas, and we just had gridlock. It was like the I-10 in Los Angeles, right? And I was yelling at my staff to clear out the lobby, let people get their grocery carts, and he came up to me as I was in aisle 3 with my adopted son from Cincinnati, and he said, "Chief, I know you're upset, but don't worry about it. Everybody in the store knows what you guys are doing, and they're just loving it. So just do what you do." So we took 200 kids. We gave them a $100 gift card to buy groceries. And I can tell you, these young people, they weren't buying Pop-Tarts and candy. They were buying nutritious food. They had their calculators and their lists out, and they were buying nutritious meals for their families for the holidays. So when I got to Cincinnati 2 years ago, we gave 100 kids $100. This year was 200. Next year, we're going to do 500. 500 kids. We're going to take it to 2 programs. Look at the faces of my captains and my officers who had their children, not their biological children, but their children that they took shopping with. We received several notes from people saying they would not have had their Christmas meal had it not been for the program. So I'll close by saying this: how do I pay for all of this? I don't make what the doctors make in here. I can't. Listen, every city has seizure forfeiture money. I believe that money we take from criminals should be reinvested in our youth. And that's what we do in Cincinnati, and we do it really well. And if anyone has any questions later, I can give you the actual data from each of the programs. There are many more, but I know I'm on a time, under time constraints. So I'll close with that, and I'll let you know that it can be done. Policing can change. We can deal with root causation, poverty, lack of education, mental illness, drug abuse, all of those things that plague our families and our communities. Police officers can help impact. We're the front line of help. And if we just change our operational platform just a little bit, be less concerned with tickets and jail and more concerned with lifting up our cities. There shouldn't be a police officer in America that's afraid to walk in any community in the city that they police. Not one. Because when you get to know the people that you police, they get to know you, and then everything changes. Everything changes when you know the people you're policing and they know you. Thank you very much.
Okay. That robust dialogue, I don't know what will. I want to thank our panelists again. We're to the fun part of today's dialogue, and I say fun because we as practitioners, and I should tell you, Chief, that the vast majority in this room are not health professionals working on the front lines. But as we open up this dialogue, I want to encourage you all to think about your questions, ask your questions. I think we have a couple of my mic keeps cutting off. Okay, great. So just shoot your hand up in the air, and we'll get your question asked and answered and get the dialogue moving. We have a couple questions on either side. Who has the mic? Yes, please stand when you have the mic. Introduce yourself, and then ask your question or make your comment.
Hi, my name is Sarah. I'm from Seattle, Washington. I'm Public Health Data Advisor at Socrata. I was really inspired and impacted by all of your talks, and I had a question for you, sir. On the end, I was really impressed with the statistics and the data that you had on your programs, and certainly they're making an impact with kids. And I think you hinted at some of the impact for police officers themselves. And I was wondering if you're tracking any data on either police perceptions or kind of policing habits or reactions. I'm wondering if you're seeing a change in attitudes, perceptions, behaviors amongst your officers as well as they get to know kids in their community, and what observations you might have around that.
Really good question. I didn't mention it, but one of the things that I think the Get the Grades program does is when you saw Officer Donald Jordan there reading to that third grader every day, becoming a big brother to him, let's just surmise for a second that he had a big brother that may have been in the game. Do you really think that he would be as violent as he has in the past, knowing that a police officer is helping his little brother learn how to read and be a better person every day? I think not. So what we have seen in Cincinnati is that by engaging with our residents, we're raising the social efficacy of our entire city. We're raising it up. When Baltimore had their situation, we were worried in Cincinnati that we would have some residual impact, and we didn't. We had Black Lives Matter have a rally downtown, but it never really turned into anything because we handled it a little differently than some of the other cities. We engaged even our protesters. And so I think that when you develop a platform of giving and helping, people perceive police officers in a different light. There isn't that automatic disconnect that exists in so many of your cities, in so many towns across this nation, when especially young people and minorities, when we see police officers, we automatically tense up. And we still do. I would imagine that you still do. I still do too. You know, you see that cruiser behind you, you make sure your seatbelt's on, turn the radio down, put the weather channel on, and you sit up, and you get real nervous, and I find myself like, what am I doing? This guy works for me. But we have to understand those feelings as police officers. You know, when the police encounter people, we have to understand that a lot of our young people, especially minority kids, Black, Hispanic, Latino kids, come to the encounter with a pocket full of rocks. Not literally, but figuratively. They have in their mind, in their DNA, every lesson that their father gave them and their grandfather. And they remember all of the things and the admonishments that they were given from their family. And the reality is, as professionals, as police professionals, we have to understand that. We have to understand that young African-American males are mistrusting and angry with us. And it's our job to ferret through all of that noise and get to the real problem with the young people. And you can't do it unless you develop relationships with them.
Thank you, Chief.
Good morning. My name is Ashley Ross, and my question comes more as a public health professional, not the agency I'm here representing. But thank you so much. This was an incredible session. It's a lot of food for thought. One of the questions that I have, and Chief Blackwell, it's probably more for you, is just, I recognize the profound complexity of all of this, so my question is kind of more isolated, just taking a bite off of that. But I'd be curious to hear more from you all about the role that the media can play in all of this. I was in New Orleans during Katrina, and I just remember that feeling afterwards in the aftermath of all of the portrayal was so negative, and it wasn't telling the story of the community resilience, even in those moments, of how people were coming together, and how can we learn from those folks? How can we help tell that story at the same time, not in any way to diminish the seriousness of what's happening, but to present that other side?
That for me?
Yes. Yes.
Okay. I think you really do have to utilize the media to celebrate your wins. In law enforcement, we have so many losses. You know, we have every news and every one of your cities leads off with every bad thing that happens in your community. All the homicides, the shootings, the stabbings, the robberies, all of that bad stuff. And so I make it a point that my 3 PIOs are always working with the media to get out all of the good stuff that we're doing. Not because we want the credit. I want to be able to show New York City it can be done. I want to be able to show Baltimore some of the things that I'm doing in Cincinnati can work. I want to be able to show and demonstrate. And it's not just me. I'm not the only outside-the-box thinking police chief. Gary McCarthy in Chicago does a lot of things like I do. Dave Brown in Dallas does. You know, Chuck McClellan in Houston, all over. We have chiefs that are thinking outside the box to be collaborators for social justice and peace in their communities. But the media does play a big role. So we always invite the media to our events that we're doing with our young people throughout Cincinnati. And it's year-long. And we don't just have one event here and one event there. We are continually in connective phases with our young people and our disenfranchised people. Just this past year, when I had a police academy class graduate, their first week out of the class, I made them spend a week in what I call service immersion. They had to go down and make sandwiches at the shelter for homeless people. And after they made the sandwiches for homeless people, they had to walk around Cincinnati and find the homeless people under the freeway overpasses and in the woods, in the homeless encampments. They spent the entire first day connecting with our homeless population in Cincinnati. And day 2, they did Meals on Wheels and went to the senior citizen homes to connect with our seniors. And then on day 3, they read books to kids in the Boys and Girls Clubs and in our schools. And I did it because I wanted them to understand that service comes first before protection. Service immersion. And I think they'll remember that their entire career.
If I can add also to that question, and from the public health perspective, which I think was the way that the question was asked as well, you know, it's such a challenge for all of us as public health professionals to talk about not only the bad things that happen, right? I mean, this, I think people hear about public health and they're like, oh, Ebola or measles, or at community meetings that we're at, the only public health questions we tend to get are, there are all these rats in our yards and there are all these rats on the street. So it's a big challenge for us, I think, to also talk about the importance of public health in preventing bad things from happening, and to use the media to showcase our successes. I mean, certainly in Baltimore, we saw all the bad ways or all the bad things that the media was portraying of our city. But we're also trying to switch that around and say, look, we have successes that we want to show as well. For example, a few years ago, we had over 100 agencies and nonprofits come together to say, look, we know that these problems are big, but infant mortality, how about we tackle as a city? Let's tackle the problem of infant mortality, because it is one that is a big problem in our city, but also is a harbinger for all these other problems that we see in public health. And we have reached the lowest rate ever that we've had in the city for infant mortality as a result of our Be More for Healthy Babies initiative. Recently, we announced an unprecedented 32% reduction in teen birth rates. These are also the things. And so these are also the success stories that we in public health have to tell. And we have to show that it's not just about rats and about these other things that we have to pay attention. And it's really about changing the narrative, changing the paradigm. You know, I'll just give you one more story about community engagement and the stories that we're hearing as well. Right after the unrest, we went door to door to pass out information about our 311 medication access line and all these other things. And you know what the first question we got was from our residents? We went to senior buildings. We're talking like 3 days after the unrest, when people didn't even know whether they were going to be okay or what was happening in the city. They asked, the first question that we got asked was, what candidate are you supporting? I mean, people actually thought that we were out there campaigning for candidates or for whatever office right after the unrest, because that's what they were used to. When people show up at their door, it's to campaign for a candidate. And the second question that we got asked when we said, this is not a candidate, this is not for a candidate, second question was, well, what survey is this? Because I filled out a survey last week. And I think that our residents in our city, just like I'm sure everywhere else, they're sick of being told, this is what you have to do, right? This is what we think you need to do, rather than really engaging the other way around. So I think part of our interaction with the media and part of our telling the story of public health is also turning it back and saying, we need you as the community to really engage in this narrative and to show the success stories and to really show why public health, why the police department, why city leadership plays such a big role.
Hi.
If you have the mic, stand up, please.
Dr. Allen, in transit epidemiologist. My question is a little bit of a duality, and forgive me, Chief, because it seems a lot of the questions will be directed to you, but to the entire panel. As a public health professional, I can tell you I had the same dichotomy with respect to having police chiefs come knocking on my door to find out how do I address Ebola, because I give them the direction, versus when I leave and have the encounters. And as I tell my friends, once a month I have a check-in, basically driving while black, get pulled over and ask, where are you going, whose car is this, and where are you headed? The reality is, though, the dichotomy and my question about bridging the gap between public health professionals and law enforcement. Both, in some respect, have police powers, right? We acknowledge that. Oftentimes, we see the only time the public health and the police departments tend to interact is for moments like communicable diseases, outbreaks, immunizations, et cetera. But what can we more specifically work upon that actually allows us to maximize our great effort surrounding things such as physical activity, nutrition. You mentioned a number of social service programs, but didn't really show health per se. What are the opportunities that we can truly use to bridge that gap, to really show that law enforcement and public health can work together for the benefit of our whole community, of our overall communities?
Well, my doctor is right there. Dr. Mesro, would you stand up? He's the health director in Cincinnati, and he and I meet. In fact, we were just in the conference room a couple of days ago talking about teen violence and youth violence, and he wanted a bunch of data that we were able to give him because we're an evidence-based agency. And he and I have started to collaborate on some things with youth violence. A lot of models, a lot of violence reduction models, ceasefire and other models that they've used in Baltimore and New York and other places, don't take in the youth component. And he and I both realized that we've got to address the youth violence as well, the 13, 14, and 15-year-olds. And then another thing, when I give speeches, I'm always talking about infant mortality and how, you know, we're trying to help impact that as well. I belong to a group called Fight Crime, Invest in Kids, and the McVee Grant, and early childhood intervention and home visiting. And he called me, he texted me one day, he saw me somewhere, I don't know, and he said, Chief, if you say it's 12% one more time, we're going to have a problem. It's only 9.1%. And so, and now I think it's even lower, right, Doc? 8.4. So to answer your question, he and I are working collaboratively to help each other in this endeavor, in the endeavor to make Cincinnati the safest big city in America and to help eradicate some of those systemic root causation issues that keep our community back.
Can I jump in?
Yes, please,
This is
please.
mine. Can you hear me?
Yes, it's live.
Awesome. So I often struggle with the question that you posed, because though you've put together amazing programs in Cincinnati, you know, there in other cities, you often have to question whether inviting police into a community is what the community actually wants and whether they feel safe with them being present. Because oftentimes their interaction with police officers, as everyone has described here, is negative. So I'm wondering whether a solution would be first to, you know, have that honest conversation with police officers. I'm curious, Chief Blackwell, you know, how you were able to kind of introduce or be very honest and frank about that conversation with, you know, other people in your city administration, with the health director specifically. Yeah, because I can't quite, every time, you know, I get a visceral reaction every time I think of bringing NYPD officers into youth programs, to be just very, very honest with you.
Right. And that is a big problem, too, in most cities. A lot of us have been taught or heard from media outlets that poor people, black people, Hispanic people, we don't care about crime because we don't call the police and we don't raise our hand and offer information. The reality is that everyone cares about crime, but what she said is so true. There's such a mistrust in so many communities about introducing law enforcement for whatever. They would rather deal with it on their own. Now, if they would rather deal with it on their own when a crime is occurring, you know they don't want a police officer coming to help in a youth program, right? And so officers have to break that down, and they have to be available. And the good thing is you have cops in every city in this nation that are the greatest people in the world. They want to be helpful. They want to be turned loose from writing tickets and you know, answering radio calls all day long, from run to run to run. But it takes courage to turn them loose, because while you're still trying to, quote unquote, handle crime and push it down, you still want to lift people up at the same time. So it's risky. It's risky to not do this as much, to do this. And everyone doesn't accept it, by the way. A lot of politicians think I'm crazy.
Great. I have a question over here.
Yeah, this has been just absolutely fantastic. Thanks for all of you pulling this together. I'm John Douglas from Colorado. My question, I guess, Chief, we don't deal with the police that often, so we're peppering you. I'm really fascinated by your observation about the culture of policing being more oriented toward warrior mentality as opposed to guardian mentality. And I'm curious if you can elaborate a little bit more about that. I could imagine that if I was a police officer, the culture of guns that surround us, where I may be expected to encounter a lethal weapon, you know, far more often than my counterpart in London, for example. I can also imagine that societal expectations may play a role in that. And you know, we're expecting you, as you said, to go stamp out crime, not go read books in the library. And I'm looks like there, and I'm sure you're aware of many more things that would make that transition difficult, but it seems like a really great observation and quite important.
Right. So the reason I'm able to say that is this. In being evidence-based, in every one of your cities, if you looked at crime and criminality and you studied the data, you would see that 1 to 2% of your populations are involved in criminal activity. That's all. 1%, maybe 2%. But what police departments do across the country is they spend 99% of their time, energy, and resources chasing 1% of the population to the detriment of the other citizens of your town. It makes no sense. Let's flip that around. Let's spend 99% of our time, energy, and resources investing in the people of our city. Now, we still have to have laser focus and the specificity that it requires to go after those really bad guys, right? We got to do that. We have to go after the influencers in our communities and the predators that are killing people and doing really, really bad things. You can't ever stop doing that. But you have to understand what the equation looks like. 99% of every city in this room is represented by good, honest, hardworking people, whether they're poor, black, or Hispanic or not. They're not criminals. And we tend to criminalize poverty a lot. We tend to criminalize zip codes a lot. And all I'm saying is that when you stop that, when you get away from that mentality of being a warrior, of big me, little you, I'm the police officer, I'm coming to tell you what we're going to do, and I'm going to tell you how we're going to do it. Problem-oriented policing in Cincinnati is just the opposite. Not only do I sit down with you to determine what the problem is, so I'm not coming to any of you saying the problem on your street is this, because you may say, Chief, that may be a problem, but it's not my problem. My problem is this. So we have a mutually agreed upon problem, and then we take it one step further in Cincinnati. We have a mutually agreed upon solution to deal with the problem. See, in many black and Hispanic neighborhoods in the city, we over-police them. We over-police with draconian police practices, really heavy-handed police practices in black and Hispanic and poor communities in this nation. People are resentful of that. People don't like that. So we've got to change that. And we don't have jump-out teams. You won't see officers in Cincinnati wearing black gloves in July. Some of you probably seen it in other places. What does that represent? What does that optic show people? That officer wants to fight someone? What's that all about? So you just have to change the paradigm a little bit, and I think it works, but it does take time. It really does take time, and you have to be able to back it up with the data.
So in our language, we call that surveillance bias, and that is the more you look, the more you find.
Absolutely.
And that can translate into racial profiling.
Absolutely. And then it becomes justified because the data then purportedly justifies your enforcement activity.
That's right. We have time for 1 or 2 questions, and I'm going to have each of our esteemed panelists give a nugget to this audience. This session is really looking through the lens of how we as local health practitioners can really bridge the gaps between law enforcement and communities. So I'm going to ask our panelists to give us a pearl on the way out. But I think we have 1 or 2 more questions. We have 2 more questions we have time for. So where are we at with the mics? Okay, over here. Thank you.
I'm with the St. Louis County Health Department, and Ferguson, Missouri is less than a mile from our main health department campus. So we're quite familiar with a lot of the emergency preparedness responses and things like that we did in the wake. Many of the conversations that have evolved since then, we have an unbelievably fragmented governmental structure in our county. We have 91 municipalities. We have over 80 police departments separately operating within our county. We've been involved lately and been asked to participate in a conversation about our recommendations from a public health and safety perspective about minimum standards and qualifications for those police departments in their training, in their outcomes, in their way that they operate as far as that's concerned. And we've had a lot of difficulty finding recommendations and best practices on what those should be as far as minimum qualifications. Because one of the recommendations that are coming out about what we've seen in our city in the conversations is consolidation of some of those police departments, consolidations of some of those municipalities, and we're being asked what our recommendations are going to be. And we would really appreciate some, I think, insight from you from your perspectives on those qualifications, those standards, what those should be.
Is that me? I guess I'll go first. I'll go first and I'll give my nugget too. I talk about this a lot, and you hit it on the head too. A lot of your agencies, wherever you're from in the room, are experiencing what every city in America is experiencing, and I call it demographic inversion. And so Ferguson 15 years ago, those folks were living in East St. Louis and other places. And so what's happening as we gentrify our cities and those places are being reclaimed by wealthy residents of our towns, people of all races and economic backgrounds are being forced further and further out. The problem with that is those agencies typically don't have the diversity in their ranks or the training, and sometimes they don't have the desire to want to change the way they police. And so I think that's the big problem in a lot of agencies when as the complexion of the constituency changes, the police department has to change too. It has to evolve. It has to understand that there are different stakeholders in the community now and they need to be dealt with differently. That's my nugget too.
One last question, Bob.
Bob England, Maricopa County Public Health in Metro Phoenix, Arizona. Just as it's a perfect follow-up to that last comment, Chief Blackwell. What you're largely describing is classic public health primary prevention kind of strategies. I'm also in a community with more than 20 cities and towns, most of whom have their own police departments. We have pretty good relationships with all of them, but only from a sort of emergency preparedness and response standpoint. As public health professionals, how do we start the conversation with our police officials about this kind of approach, given that, frankly, the little conversations I've had so far, many very good, well-meaning police officers and officials are feeling pretty beat up right now because of the attention on police violence. How do I broach the issue in a non-threatening way and get this started?
That's for me too.
I think it's for you. How do you, let me put it this way, how do you approach your colleagues in other communities when you talk about this in a way that helps them feel less threatened?
And I'm going to ask all of the panelists to address that as well.
Okay. Well, what I do essentially is I just try to demonstrate that it can be done. You know, I'm at an age right now where I'm really trying to walk my truth, and I understand what the fracture looks like in this country. I understand what the racism does to young people and the disenfranchisement does. I get that. But I also understand from being a police officer for 30 years how we can help if we choose to do it. And I think police officers will do what they're told to do. You have someone in your agency in Phoenix, and you have a great assistant city manager in Milton Dehoney there, but they just have to have the courage to turn these police officers, male and female officers, loose and let them do their thing in the community, and they will. I'm not alone. There are a lot of police officers that love young people, that want to help, that want to be difference makers, that are coaches and mentors and, you know, parents in absentia for a lot of these young people. They love them and they get it. The only thing I've done is take it to a level where I allow these officers to do it full time. And I think that is the risky part of the equation, is taking officers away from crime fighting and letting them be in the business of cultivation of young people. I think it'll work. The seeds are being planted now. It may not come to fruition in my career, but they will in the future.
So I'd like to just briefly share tactics that have worked in our city. So Mayor de Blasio early last year announced a citywide behavioral health and criminal justice task force. So in this instance, it was our city's leadership that said there are a number of huge issues that we need to solve. We need to pull all of the agencies together to work collectively to address them. So, you know, one just example of an issue that our department, our agency, and the police forces come together on is the issue of picking up people with mental illness and jailing them, right? So what we've done is we've partnered together to develop what we call drop-off centers, right? So when police officers encounter a person who may be homeless and mentally ill, rather than arrest them and take them to jail, because we've had, you know, sad stories of people who've been taken to jail and then who've died, essentially, when they were on the island. So we recognize there are serious health risks associated with it. They bring them to these drop-off centers to receive help, to get connected to better treatment and shelter. So it's finding the key issues that we can both kind of partner on, we can agree, like there's, basically a huge problem at hand. And then it is in those spaces that more conversations can happen, right? So it's also in that space that we, we're able to kind of have conversations with our Manhattan District Attorney's Office, who then decided to use their seizure funds to fund these drop-off centers. So I'd say, it starts with our city's leadership, but then also identifying the issues that we can collectively agree impact both health and safety.
So this is my nugget, but maybe it's not really a nugget. I just want to actually just tell you that this is a very difficult panel for me to sit on for a number of reasons, including that, as you may have heard, our police commissioner in Baltimore was fired yesterday afternoon. And to speak on a panel about police relations and public health the day after that is very difficult. Prior to Commissioner Batts being let go yesterday, over the last several months that we've been working together, we have started many programs that do integrate public health and policing, including a lot around behavioral health. We have been looking into developing a program for mental health policing so that there's a plainclothes police officer who partners with an addiction counselor and social worker to, instead of jailing our homeless individuals or not understanding the behavior that they may be exhibiting, but rather helping them find the help that they need. And we are also in the process of training our police officers on using naloxone, which actually does help to change, even though it seems like a fairly minor step. First of all, it may have the potential to save people's lives, but also it does change the mentality, again, from the warrior mentality to the protector, to this is your job, right? This is all of our jobs together to save the lives of individuals in our city. In Baltimore, there is a long history of the police working closely with the public health department as well. We have a program called Operation Safe Kids, for example, where we, together with the police department, find case management for those kids, those juveniles in the city who have committed crimes, but who are really the most vulnerable, and in finding them the services that they need. And so certainly it's my hope in Baltimore moving forward with the interim commissioner and in general with the men and women on our police force who are very dedicated to the city to find better ways, using many of the strategies that we've talked about today, I think, in really listening to our community, engaging our community, but also understanding that it's not an easy path for us, that certainly in our city, as I'm sure in others around the country, there is a lot of trust for us to rebuild, that it's not an easy step, but I do think that we have to start somewhere, and why not with all of us in public health?
And in closing, I'll get back to where we started with in 1992 with Rodney King. And Rodney King made a statement that became infamous, if you will. And that statement is, can we all just get along? And in some ways, that was really a call to action. I think it wasn't just a call to action between black and brown men and police officers. I think it was a call to action in terms of collective responsibility. And that's what we've heard here today in terms of collective responsibility. In that, there's a role for each of us. There certainly is a role for local public health in this, but it starts with this uncomfortable conversation. So I want to thank you all for being a part of this conversation. I want to thank our esteemed panel for their insight and their honesty and their transparency in kicking this off.